as with all surgeries, there are definitely risks involved with surgery. So you will have scars, and we'll go over where those scars are going to be depending on what lift you're doing. You will also have some swelling that will go away after surgery. You can also have some risks of some wound healing problems. So anywhere that there's 3 points coming together, so around the nipple meeting the vertical or the vertical meeting the horizontal, you can have little areas that open up. Those usually are really well treated with just some over-the-counter antibiotic cream, some gauze. They usually heal up with no problems. You can also get some changes in your nipple sensation. Most people don't, but that is a possibility. And also some changes to sensation around your breast. Very rarely we can have a blood collection called a hematoma form or fluid collection called a seroma form, and in those cases we'll go over what we would have to do in order to treat those. Additionally, there can be some risk of infection, so we give you antibiotics after surgery, and then we also ask that you take the appropriate measures in keeping everything clean and dry, making sure you're not using bar soap or loofahs, which can harbor bacteria, making sure you're not having pets in the bag, which can introduce bacteria, and so we do our part together in decreasing our risk of infection. If you do notice any redness, swelling, anything like that, let me know immediately and we can put you on antibiotics to treat that. So as always, breasts are sisters, not twins. So whenever we go through your photos, I'm going to point out some asymmetries from one side to the other. Everyone has these. And you're not perfectly symmetric before surgery, and you're not going to be perfectly symmetric after surgery. We do everything that we can to make sure that they are as symmetric as possible, but you are always going to have some asymmetries from one side to the other.